This screencast is about risk coding, otherwise known as HCC coding. There's going to be two ways for you to view patient risk in a patient's chart. So if the patient hasn't arrived in the office yet, you can click on the patient risk tab, and there you can see all the diagnoses that have already been added. If you want to find out if one should be added, then what you could do is you could go back to the health history tab and you could just kind of browse over these. If you already know what can be risk adjusted, then you could, go back and add it. Now, that's not something I expect everyone to know how to do, but certainly if you want to do it, you're more than welcome to do it. So high blood pressure is not risk adjusted, but depression can be. So we'll go back to the tab and say add potential diagnosis, and we'll just type in the word depression. So there's, hundreds of different diagnoses for depression, but it's only showing us 4 because these are only the 4 that are weighted for risk. So a regular, single episode of depression without psychotic features doesn't need to be added if that's what this person has. But if they have chronic depression, just unspecified, then we could add that, and it's going to add us another extra points there, and then you would just hit save. So now if the patient is checked in, then you could go to their current encounter, and you can jump down to assessment and plan. This might be something you want to do before you go and get the patient. That way you can see all the codes that need to be dropped down, and then you can also figure out if you need to ask any additional questions. So we'll go drop down, and I've already had the tab open, but usually it'll show up like this, and then you can just see there's an orange number on the patient risk. If the person only had 1 risk, then it's only going to show up as 1. So, and also let me just point out that I saved this before we added the depression, so that's why only 3 is showing up here. Probably if I went out and came back in, it would show up, but that doesn't really matter right at this moment. So what we'll do is we'll drop in the codes from this test patient. You'll notice that some of them will say choose diagnosis, and then others will say add to A&P. So if you click on choose diagnosis for the type 2, you're going to get this box, and what you want to do is you want to just search for something that's most consistent with what you're looking for. So this type 2, we know that that's what the person has. We can see that type 2 is right there. So you could just click there, and then it's going to change it to add to A&P. We'll do the same thing with the atrial fibrillation. And you see, if you don't remember what it was, you can also just look over to the gray area and see the diagnosis. So there we'll click atrial fibrillation, and then they'll all say add to A&P. So we'll click add to A&P, and it'll drop down. Same with morbid obesity and atrial fibrillation. So then you'll also notice that that orange number is no longer there, meaning you don't have to do anything else to this tab. And then the gap is also closed. Before, the gap would have showed you the total number of diagnoses, risks, weight that was not added to the chart. But now that it is, it's back to 0 because there's no gap. So the thing with these codes is that there's certain requirements for adding them to the chart. So let's say a patient was here for a cold, but it's the first visit of the year. That means that these codes have to be added to the encounter, because these codes for chronic conditions have to be added at least once in a calendar year to satisfy the requirements. So say, they're here for a cold, they have these chronic conditions, and you already added these before you got the patient. When you go and get the patient, you're going to want to follow an acronym that Privia has called MEET. And what that stands for is monitored, evaluated, assessed, and treatment. So that can be as simple as, let's say this one's diagnosis with hyperglycemia. So that means they're uncontrolled. So we could say uncontrolled for now, continue on current medications, but they need to schedule an office visit with fasting blood work next week, to see the provider. Let's say if they were controlled, you could say controlled, continue on current meds, and then if they need to follow up, in 6 months, then you can just say followed in 6 months. But this would need to be done for each diagnosis. So if it was morbid obesity, you might say, they are exercising, following a healthy diet, and not on any medications if they're not on any medications, something like that. If they have atrial fibrillation, you don't have anything to do with that. You can just say, sees specialist every 6 months, up to date, taking med as directed. Just something very simple, but if you can add that in there. So like I said, this has to be done just once in a calendar year. For these codes, you just have to put in a little statement for each thing. And then right now, the main focus would be that we need to do this for all the Medicare patients. Now, if somebody's not a Medicare patient and you see they have an orange number next to the patient risk, it's still a good idea to go ahead and start doing this, because in the end, we're going to have to do this for every single patient. So we might as well get used to it. So basically what would happen is the clinical staff is going to work this into their workflow, but then the provider is going to need to come back, at the end and confirm that each one of these ICD-10 codes is the right code for the patient. If not, then you just need to update that before you sign off on your chart. Okay, that pretty much wraps it up. And as always, let me know if you have any questions.